6 News anchor Lori Tucker has much more in tonight's Caring for Our Kids. Lori.
Thank you, Kristen. Acetaminophen and ibuprofen, those are the two main pain relievers parents most often reach for when their child is sick. Both are safe, both are effective when they're used the right way. But getting an overdose of any pain medication is so serious for a child, and it can happen a lot easier than you might think. So joining us here with some advice to protect our children is Dr. Ryan Redmond, ER Director at Children's Hospital. Always good to see you.
Thank you.
So do you see overdoses of pain medicine in children?
We do, unfortunately, and it tends to be one of two varieties. One of them is medication that the child gets into because they like the taste or they think it's candy, so they take too much of it that way. The other way we see it is with parents who kind of use inappropriate doses or dose too often or use two medications that have the same ingredient in them.
You really need to read those labels, and if you have a question, call the doctor.
Absolutely.
Yeah. What happens when a child gets too much medicine? What are the symptoms?
So it depends, of course, on which medicine it is. Now, when you're talking about Tylenol, the thing we really worry about is liver damage and specifically liver failure. Now, normally that takes a lot of Tylenol. So, we don't want people to be afraid because Tylenol is a useful tool to use for fever and for pain when given in appropriate doses. But when you get too much, you can have problems with metabolizing that does cause liver damage.
Why you said Tylenol works, so maybe I'm answering this question, but I'm often surprised that it is prescribed so often when there is that chance for liver damage. Why not go to something else?
Well, that's one of the reasons that people have started to use a little bit more ibuprofen was because that spares the liver effects. However, Tylenol does have a long track record of safety, and that's one of the things that we always are very concerned about in kids because kids metabolize medicines differently than they do adults. So we like to see things that have been around for a long time that have proven to be safe, which Tylenol is when it's appropriately used.
All right. Should parents ever be worried about using over-the-counter pain medications without checking with the doctor first?
It's usually a good idea to always consult with your doctor. Now, sometimes that can be done in advance at your well child check, say, hey, what's an appropriate dose for our weight now and all of that kind of stuff. But typically it's a good idea to discuss all medications with your physician.
That's a good question to ask. And also, when is the point when you need to say, you know what, we need to go to the ER?
Anytime that there's any question about whether or not you've gotten too much medication, and that can happen as a part of a simple error, or that can happen as a part of, maybe the dad is giving the medication, the mom's also giving medication, they didn't realize they were each doing it.
Leave notes.
Exactly. and so anytime that there's a question, consult your physician, and anytime you see symptoms that you're concerned might be related to medication, then visit your physician or the ER.
All right, as always, good to know. Thank you so much, Doctor. And if you have a question about your child's health, just send me an email, ltucker@wate.com, and be sure to join us every Thursday here on 6 News at 5:30. We just might use your question on the air.